normal services, we also will be providing PCR testing. Thank you, Mark. PCR testing for COVID-19 at all of those sites. So again, starting Monday, we have changes in our operations at Family Health, the primary care division of the Mobile County Health Department. Starting Monday, all locations will be open from 7:30 a.m. to 4:30 p.m. on weekdays. And for a list of locations, you can visit familyhealthalabama.org. This applies to our Children's Health Center at New Bern, the Citronelle Health Center, the Dauphin Island Parkway location, 8 Mile, North Mobile, Sims, Southwest Mobile, and Women's Health at the same location as the Children's Health Center, and then our downtown location on North Bayou Street. The other big change is that our medical triage pharmacy refill lines are going to be directed to our main switchboard now. So the main switchboard is 251-690-8158. So those lines that we stood up, including the COVID information line, will no longer be manned. Everything will just be going to our main number as it normally is. We still can direct COVID questions to the State Health Department at 800-270-7268. So again, all persons visiting a site will be screened for illness prior to entering the building, and patients and visitors over the age of 2 are required to have a face covering on before entering the building. So that's important, so come prepared with your own face covering if you have one, and if not, we will figure out how to accommodate you. Adult patients should come alone. Pediatric patients are limited to 1 parent or guardian. Family Health will continue to offer telehealth services for all life cycles with primary care and optometry. So please call the appointment line to secure a time, even for telehealth. Vital Records is still open downtown, and I don't think that's changed. I'm sorry?
5 days now.
5 days. Okay, sorry. Mark's telling me that Vital Records is now opening all 5 days, weekdays, 7:30 to 4:30. I think that's about it. Okay, thank you. All right, I'll just hold on to your phone. Okay, a couple of questions that have come up. Let's see, a media question. I always think I should have read these before I look at them. Let's see. A politician in Mobile said he felt that Mobile County should allow for random testing for a short period of time to get a better understanding of how prevalent the virus is in the community. So we know that testing, the availability of testing has gone up dramatically since we first started talking about this in March. I looked at some numbers. Early March, in Mobile County, only about 125 residents a day were getting tested. And as recently as last week, 450 a day were getting tested. So we think we have plenty of capacity for testing. And if you feel like you need to be tested for COVID and you've not been able to find a location to do that, then call our appointment line and you can get tested at one of our locations around the county. The appointment line is 251-690-8889, and we will test you regardless of your ability to pay. So I just want to make sure that you guys know that we're hearing that we needed more testing sort of out in the areas, so we're getting that done. And there was a comment then about, is it time for us to do a point prevalence study? That's not what they're asking for, but right now we're still very early in the duration of this outbreak, and I think stopping now and diverting resources to doing a point prevalence study where we kind of randomly test people in Mobile County, I don't think that's the best use of our public health resources right now. But CDC is doing some of that work in some of the cities that were impacted very early on and heavily. So I expect at some point we will get more information about that, but Mobile County Health Department will not be doing that. Focused on Mobile, it's odd that so few cases in Baldwin County, considering how linked it is to Mobile. Is this unusual based on the experience? So, I've only been with Mobile County Health Department for about 7-8 months. But for Mobile County, I've seen this similar trend with other with another outbreak that we've had, a hepatitis A outbreak, that it seems like transmission in those younger age groups, so 24 to 64, that it comes from the west, not from the east. And so it seems to be moving along the I-10 corridor, sort of coming from Louisiana through Mississippi and then into Alabama and on over that way. So we see this difference with lots of diseases where Mobile has more cases than a neighboring county to our east or to our north. A lot of that, some of that has to do with density, population density, and some of it has to do with other health disparities and known socioeconomic differences between our populations. What is the status of COVID patient bed capacity and ventilators in area hospital? The status is that the capacity is good. It is more than sufficient for the need, and that is really good news, and partly why they are able to start rescheduling elective procedures. There's a question here about rare complications in children, something called pediatric multisystem inflammatory syndrome. Sorry, I've not read up on that, so I'll get back to that maybe next week. Someone was asking about some changes over time in the number of deaths that we were reporting on the daily report. So I'm going to look into this over the weekend, because we are not perfect. We have errors. It happens. We try to do our best, but sometimes it happens. So I'll look at it over the weekend. But I will say that these are ongoing investigations, right? We are reporting data on investigations as they are happening. So I keep, said that we're like building the ship while we're trying to sail it. And, it's not a surprise that we maybe counted a case today as a Mobile County case, and then, later on in the day we found out that they actually live in George County, Mississippi, and then we would transfer the case to Mississippi. So this sort of thing happens a lot with surveillance data, particularly when we're reporting it as quickly as we do now. In normal times, we have the luxury of taking several days, making sure all the information is as accurate as we can get it, and then publishing that data, and still we usually wait a few weeks before we report it out. So I'm not concerned about when numbers kind of fluctuate in and out as the days go by, because these are real-time data that we're sharing with you. Let's see. Will you start testing in all nursing homes? We are testing in all of the nursing homes that have, patients or residents that are suspected of carrying COVID. And even in the nursing homes that do not have any cases, we've been working really hard over the past, month, 6 weeks, to make sure that they had capacity for testing in-house, so that when they suspected someone as a COVID carrier, that they could test them right away. So we have a lot of testing that is going on in nursing homes of both employees and residents. If you are an essential worker and cases are noted on your job, what's the process for testing other workers? This depends. If public health notices that there is a cluster of disease associated with a particular location, we will investigate that and try to provide advice. Sorry, I was trying to say guidance and advice at the same time. Provide advice on who should stay home, who should get tested, disinfection, infection control, those sorts of things. So that is and then we decide in consultation with the employees and with the business owner what employees need to get tested, and then if we need to, we can arrange to have them tested either at one of our locations or someplace else if the worker is insured, for example. But we've not done that. We've not had a cluster investigation at a business other than a healthcare facility or a correctional center that I know of. But now that I've said that, of course, it's going to happen, no doubt. Okay. Is the low population rate as compared to other southeastern states a result of testing being delayed in Mobile? No, I do not think that is the case. As I said, data that I have seen that you guys have not shows that week over week, we have the bars have gone like this on how many people are getting tested. right? And the cases are not going up like that. The amount of tests, the number of tests we're conducting is. So I don't think that that's due to delay in test results. Has anyone died at home? I don't know the answer to this question. We had a couple of investigations of people who died at home that had no other reasonable explanation for their death. I think we had 2. And postmortem specimens have to be collected, and then those have to go to the state lab and to CDC. It takes a really long time to get that information back. So I don't know the answer to that question. When will bars and nail salons open back up? May 11th, as long as they are following all of the physical distancing, disinfection, and protective procedures for their customers. Let's see. All right, and I think that is it.
One from the media.
Okay.
It stated bars are allowed to reopen on Monday, but nightclubs are not. Does it say what the difference is?
So the question is about nightclubs can have to close, but bars can stay open. So we asked Montgomery, this question started almost immediately, and we have asked Montgomery, we've talked to the ABC board, we've talked to Montgomery Inspection Services, the folks who statewide inspect bars and restaurants and nightclubs, and no one seems to know that there is an official definition of nightclub in Alabama, or how a nightclub differs from a bar. So stay tuned on that. I expect you'll see some clarification in an FAQ that's going to come out of the mayor's office very soon. But in general, a nightclub is a place where you might have music and dancing. Look it up in Webster's dictionary. I think that's what it says. So if you are a bar that has music and dancing, then you probably should not plan on opening on Monday night. But if you are a restaurant with a bar, or I think even social clubs that have a bar can open, but again, you have to be able to maintain that 6-foot physical distance between patrons. So more to come on that. All right, thank you all. Have a lovely weekend, and we'll talk to you again on Monday.
This has been a Fox 10 News Coronavirus Update. For the latest breaking news, stay with Fox 10 News on air, online, and on the Fox 10 News app. We now join our regularly scheduled program already in progress.